Welcome to Roadmap to Residency. Hello everyone, I am Abhiraz. Welcome to our Club 250 Mass Maker sessions. We will be running through some questions with you guys to help you on your journey to a 250, and currently we are in our psychiatry modules, and this video is all about sleep disorders. So which of the following medications has the lowest risk of causing adverse effects in this patient? A 76-year-old man comes to the office due to severe insomnia of several months duration. He has trouble falling asleep and feels tired and irritable during the day. The patient's other medical problems include hypertension and prior cerebrovascular accident with residual right leg weakness. He takes aspirin, rosuvastatin, and lisinopril regularly as prescribed. Temperature is 98.1 degree Fahrenheit. Blood pressure is 118/76. Pulse is 62 per minute. And respirations are 14 per minute. Examination shows clear lungs with normal S1 and S2. The abdomen is soft and non-tender. In addition to non-pharmacological interventions of insomnia, short-term pharmacological therapy is being considered. Which of the following medications have the lowest risk of causing adverse effects in this patient? Alprazolam, amitriptyline, clonazepam, diazepam, diphenhydramine, quetiapine, or ramelteon. So insomnia is commonly in the elderly population and can significantly impair the quality of life. Non-pharmacological interventions such as sleep hygiene measures and cognitive behavior therapy are recommended for initial treatment. Now, when non-pharmacological interventions fail, pharmacotherapy may be indicated but must be used with extreme caution in elderly patients and should generally be limited of short-term management. The medication selection for elderly patients requires special attention to safety issues due to this population's increased sensitivity to adverse effects of medication in general and sedative hypnotic agents in particular. Example, oversedation, dizziness, confusion, impaired psychomotor performance, or ataxia. Now, the currently available sedative hypnotic drugs, the melatonin agonist ramelteon has demonstrated the lowest side effect burden in older patients. Ramelteon binds with high affinity to the melatonin receptors in the suprachiasmatic nucleus. Choice A, C, and D, benzodiazepines will be avoided in early patients due to the increased risk of cognitive impairment, delirium, falls, fractures, and motor vehicle accidents when taking these medications. Now, let's talk about the DSM-5 criteria for the insomnia disorder. So, dissatisfaction with sleep quantity or quality associated with difficulty initiating sleep, difficulty maintaining sleep, or early morning awakening with inability to return to sleep. Sleep disturbance causes clinical significant distress or impairment in social, occupational, educational, academic, behavioral, or other important areas of functioning. Sleep difficulty occurs at least 3 nights per week. Sleep difficulty is present for at least 3 months. Sleep difficulty occurs despite the adequate opportunity for sleep. Insomnia is not better explained by another sleep-wake disorder, a coexisting mental disorder, or the physiological effects of a substance. So always rule out substance use disorder. So the choices B and D. That is B and E. There's amitriptyline, tricycline, antidepressant, and diphenhydramine are antihistamine. Should be avoided in the elderly due to the strong anticholinergic effects and risk of sedation, delirium, and falls. Elderly patient risk of osteoporosis if they have just have a fall injury, then they can have fractures. Quetiapine is a second generation antipsychotic that would not be appropriate as a first line treatment of insomnia. Antipsychotics carry a risk of increased falls and cardiac mortality in older adults and should not be used without an appropriate indication. So, which of the following best characterizes the primary features of the sleep disorder in this patient? A 45-year-old overweight man presents to the sleep clinic with complaints of loud snoring and excessive daytime sleepiness. His partner reports witnessing episodes during sleep where he stops breathing for several seconds before gasping for air. The patient denies a history of insomnia, but he often wakes up with a dry mouth and headache. The physical examination reveals an obese individual with a neck circumference of 17 inches. Polysomnography shows frequent episodes of apnea and hypopnea, with an apnea-hypopnea index of 30 units per hour. Which of the following best characterizes the primary features of sleep disorder in this patient? Difficulty falling asleep and staying asleep, sleepwalking and night terrors, frequent episodes of apnea and hypopnea, loud snoring and daytime sleepiness, excessive dreaming, limb movements, and during sleep, nightmares, and disrupted sleep wake cycle. So frequent episodes of apnea and hypopnea, loud snoring, and daytime sleepiness. The primary features described uh, are characteristic of obstructive sleep apnea in this patient. So this patient is obese, have a neck circumference of 17 inches, is having obstructive sleep apnea. So obstructive apnea, signs and symptoms will be snoring, transient apnea, excessive daytime sleepiness, morning headache, insomnia, restless sleep, nightmares, memory loss, performance deficiencies, depression, GERD, nocturnal impotence. Physical findings may be enlarged uvula, hyperplastic soft palate, nasal congestion, nasal polyps, enlarged tonsils, enlarged tongue, small lower jaw, receded chin, neck size more than 17 inches, and overweight or obese. Or there is also one condition that we will read in respiratory system about the obesity hypoventilation syndrome. So which of the following best characterizes the primary features of sleep disorder in this patient? So 30-year-old woman presents to the sleep clinic with complaint of sudden and irresistible episodes of sleep during the day. She describes experiencing episodes of muscle weakness, often triggered by laughter or other strong emotions. The patient also reports vivid dream-like experiences upon falling asleep and waking up, known as hypnagogic and hypnopompic hallucinations, respectively. So hypnagogic is when going to sleep. So gogic, going to sleep. And hypnopompic, waking up from sleep. Additionally, she notes episodes of cataplexy characterized by sudden loss of muscle tone, typically in response to strong emotions. Polysomnography reveals rapid eye movement, sleep occurring within 10 minutes of sleep onset. Which of the following best characterizes the primary feature of the sleep disorder in this patient? Frequent episodes of apnea and hypopnea, loud snoring and daytime sleepiness, difficulty falling asleep and staying asleep, sudden and irresistible uh, episodes of sleep, muscle weakness, hypnagogic and hypnopompic hallucinations, and cataplexy. Excessive dreaming and limb movements during sleep, nightmares, and disrupted sleep-wake cycle. So sudden and irresistible episodes of sleep, muscle weakness, hypnagogic and hypnopompic hallucinations, and cataplexy are characteristic of narcolepsy. So this patient is going, is this patient, the diagnosis here is narcolepsy. So what causes narcolepsy? So hypocreatine is a peptide or a small protein that revises activity in the hypothalamus. A chemical named histamine specifically promotes wakefulness. When the amount of histamine is too low, the body begins to shut down and slowly doze off. So that's how you get narcolepsy. Low levels of epinephrine, a hormone more important in alertness and arousal, also causes REM sleep. Higher than normal secretion of growth hormone during the day, which may play a role in sudden falling asleep episodes like narcolepsy. Which of the following best characterizes the primary feature of sleep disorder in this patient? Now let's see what sleep disorder the patient is having. A 55-year-old woman complains of uncomfortable sensation in her legs that occurs predominantly at night and is relieved by moving her legs. She describes the sensations as creepy, crawly, itchy, or pins and needles. The symptoms often interfere with her ability to fall asleep, leading to disrupted sleep and daytime fatigue. Physical examination is unremarkable and routine lab tests are within normal limits. Which of the following best characterizes the primary features of sleep disorder in this patient? Frequent episodes of apnea and hypopnea, loud snoring and daytime sleepiness, difficulty falling asleep and staying asleep, um, uncomfortable sensation in legs, primarily at night, relieved by movement, excessive dreaming and limb movements during the sleep, sudden and irresistible episodes of sleep, and weight muscle weakness and cataplexy. So option number C, the patient is suffering from the restless leg syndrome. So the primary features described including uncomfortable sensation in the legs that occur predominantly at night and are relieved by movement, a characteristic of restless leg syndrome. Thank you for watching. Keep studying hard.